At the age of 2, a child received from 18 to 26 vaccinations, tripling the amount the child would have received in the 1970s. Parents are beginning to question the increased number of vaccinations and their purposes. Some parents have taken a strategy of spreading out the vaccinations using their own schedule, while other parents have stopped vaccinating altogether. What would happen if a family were to not vaccinate at all? Imagine a child comes home from school one day with a cough and a red throat. The parent thinks nothing of it until the child gets progressively worse. Upon visiting a doctor, the parent learns that the child has measles. What? How is this possible? Isn't that disease wiped out? Well, according to Leanne Sun, a writer for the Washington Post, for parents in Minnesota, this was a reality in 2016, when an outbreak of the measles occurred. In total, there were 65 confirmed cases, but no fatalities from this disease. 62 of the 65 cases were from unvaccinated individuals. Only 20 of those who were vaccinated Only 20 of those who became ill were hospitalized. 62 of the 65 individuals were unvaccinated. 20 who were hospitalized were treated for hydration or pneumonia, then later released from the hospital. In accordance with the Children's Hospital in Minnesota, the source of the disease was found to be a close-knit Somali community. This was because of a concern that vaccinations cause autism. This is because anti-vaxxers have been spreading literature among the community suggesting these concerns. Later, the literature was proven false and had to be retracted. According to CNN, in Texas and Arkansas in 2017, there were 2,931 confirmed cases of the mumps, the state's largest outbreak in 22 years. Patients suffer from symptoms including headaches, body aches, and a loss of appetite. They also suffer from swollen salivary glands causing puffy cheeks and swollen jaw. These symptoms can last up to 10 days, these symptoms can last no longer than 10 days, but will manage to stay around for at least 2. Because mumps is a virus, doctors recommend over-the-counter pain relievers and bed rest for the best treatment. The reason for such a high outbreak was due to the fact of the falling number of children who were vaccinated against the disease. The other reason is that after so many years, the vaccine is only 85% effective, leaving many adults susceptible to the disease. Still, many families are cautious about vaccinations and have taken it upon themselves to spread out the scheduled vaccinations. Some parents believe that receiving so many vaccinations early on can hurt a child or make them ill. While the child may experience mild symptoms like a fever, that is normal for the inoculation period. According to the U.S. Department of Health and Human Services, experts have found that spreading out the scheduled vaccinations doesn't help at all. Rather, it can cause a child to be more susceptible to the various diseases that the vaccines are preventing. The earlier that a child is vaccinated, the more immunity they will build. The schedule has been set up to best benefit the child and the child's family. Why has there been such a dramatic increase in the number of shots from 1970 to now? Consistent with the Center for Disease Control and Prevention, the vaccination schedule has made changes from when it was first put out. The 1970 schedule consisted of 3 vaccinations protecting against tetanus, diphtheria, whooping cough, polio, measles, and rubella. In the 1940s, the smallpox vaccination was also on the recommended list, but was later removed after the disease was wiped out. As of 2014, The current vaccination list has 11 vaccines listed on it. They are for hepatitis A and B, rotavirus, diphtheria, tetanus, pertussis, measles, mumps, and rubella, combined into the MMR vaccine, chickenpox, and meningococcal. This is for high-risk cases only, though. The reason behind the list growing and changing is because doctors have found more preventative measures for these diseases and have found more relevant diseases. These shots should all be received not just to protect yourself or your loved ones. What about children who have immune systems that can't handle vaccines? According to Vaccine Truth, suffering from diseases like cystic fibrosis depend on classmates and friends to receive the vaccination to protect them. If a child with cystic fibrosis contracts any minor infection or sickness, it can almost guarantee a hospital trip until they are well again. It could also mean certain death for these children. It is a huge cop-out for a parent of a non-vaccinated child to say, why does my child need to be vaccinated if your child is? The fact still remains that child is not vaccinated. The Department of Health and Human Services tells about another example of a child that cannot receive vaccinations, or children who receive organ transplants. The reason being is not because their body can not handle the vaccine. It is because their immune system cannot develop an adaptive response rendering the vaccine useless. Currently, the state of Mississippi is the only state that doesn't allow vaccination exemptions except for medical purposes. The state has a 99% vaccine rate, making it the safest place for those who can't get vaccinated. We should all vaccinate, not just to protect those who we love, but also those we do not know. To not vaccinate one's child because they don't agree with the number of shots or the schedule is selfish. Other children and adults depend on others to make the right decision. Science has disproven all theories about vaccinations causing autism. The thing science has proven is that not vaccinating your child can lead to an outbreak. So make the logical decision and vaccinate.